Good morning. Can you hear me now? That's the theme of today's presentation. My name is Tom Piper. I am pleased to be the coordinator and so pleased for the next 2 hours of wonderful information that are about to be shared with you. Both of our presenters are here today, and there is an evaluation form at the end, at the front of the table in front of you that we'd like you to turn in at the end of today's session, or just leave it at your table and we'll pick it up. And but we have a few people who still have yet to arrive. They told me that they are a little bit delayed. But our first presenter today is Dr. Tessa Nguyen. She is a California native who received her bachelor's degree in biological sciences with a concentration in cell and developmental biology from the California State University in Fullerton. And her doctorate of audiology is from Northwestern University. She's currently one of 12 audiologists at the University of Missouri ENT-Hearing-Balance Center, where she treats and manages all types of hearing loss, including evaluation and fitting of hearing aids and cochlear implants. She also sees patients for comprehensive vestibular testing. Her brother has hearing loss, was one of her biggest inspirations for pursuing audiology. And in her free time, really, she enjoys jigsaw puzzles and eating sushi. I like both as well. Please welcome Dr. Nguyen. Thank you.
Good morning. Can everybody hear me okay? All right. So I am going to go through this presentation, and I just want to let everybody know, if you have any questions, please raise your hand. I'm happy to stop and answer your questions as we go. You don't have to wait for the end, okay? And so as Tom kind of said, I'm from California, so I'm a long ways from home. I have not seen snow until about 3 years ago, and that was a life changer for me. Fell in love with Missouri Falls and decided to stay here. I think the leaves are beautiful. And so it's definitely a culture shock for me, but I love it so far. And so, there we go. Just a little bit about me. Like he said, I have my background in biological sciences and got my doctorate in audiology from Northwestern. My brother and my cousin do both have hearing loss. They were a huge inspiration for me pursuing this field. I was talking to David earlier, and I kind of said one of my favorite things is about audiology in general is that it's a blend of science and art, is kind of what we said. So two people with the exact same hearing loss can really experience it differently. So it's really important to take your patients' reports as well as everything that I've learned from my background and kind of mixing those two together. Everybody has, different lifestyles. Some people have more quiet lifestyles. They're at home, they like to read, while others enjoy being part of, gardening groups or groups like this, and those are more difficult listening situations. So you have to take a person's background into account when talking about things like hearing aids and things like that. Just the general scope of practice of an audiologist includes hearing loss, so evaluation and treatment of different types of hearing loss. Balance disorders, our ear is responsible for a lot of our balance, which we'll talk about here in a minute. Tinnitus, which is defined as any kind of ringing or buzzing in your ears. And amplification, that includes hearing aids, cochlear implants, and other things. At the University of Missouri, yes.
Thank you.
Yeah. At the University of Missouri ENT-Hearing-Balance, we do have 12 audiologists as well as 14 ENT providers, so we are a big clinic. We are located in Columbia as well as Jefferson City, so you can get your hearing tested and you can get hearing aids from both locations. And then we do evaluate and treat patients from birth to death. A lot of people ask me how I evaluate, a 2-day-old, but there are ways. And so you can have hearing loss at any age. A lot of people have kind of the stigma of, oh, it's only for old people. That's not true. It's possible that you can have hearing loss from a younger age as well. Just a general overview of the ear. Most people are familiar with the outer ear. That is what's going to funnel all the sound, and that is where earwax typically lives. That ear is going to collect all the sound. It's going to go down our ear canal, so if there's any wax in the way, it will kind of prohibit sound from getting in clearly. Then the sound waves do hit that middle ear, so it hits our eardrum and it vibrates those little bones in our ear. So movement of the eardrum causes those middle ear bones to move as well. Again, if there's any kind of fluid in that middle ear space, that's considered an ear infection. It can inhibit those bones from moving correctly, inhibit the eardrum from moving correctly, and cause hearing loss. It's also possible, just with genetics and other things, that those bones might kind of ossify or harden, so they're not moving correctly, or with any kind of trauma, if you get hit in the head or something like that, those bones, just like any other bones, can move out of place, also causing hearing loss. So there's a lot of places in the ear where things can go wrong and cause hearing loss. This little snail-shaped guy here is called the cochlea. He is responsible for detecting pitch and sound. So once those middle eardrums move, they also send encoded messages to that little snail-shaped guy, and that is what's responsible for giving us sound and sending electric impulses to our hearing nerve, and that's how we hear everything. So again, anywhere in that process, if there is a breakdown, it can cause a hearing loss. It can cause muffled hearing, just lack of clarity, or things could just often sound like they're underwater, or any of those. So if we take that snail-shaped guy and we unravel him, it will kind of resemble keys on a piano. So every single spot on the cochlea is responsible for a very specific pitch. So if we stimulate that part, that's going to give us a certain pitch. You kind of combine all of those together, and that's what gives us complicated sounds like music or speech. Any kind of breakdown in that cochlea over time, and we'll kind of talk about some of the causes that can cause that breakdown, will result in that hearing loss that we were kind of talking about. And overall, hearing can affect cognition and quality of life. A lot of the times when we have hearing loss, we don't want to go out with friends or groups because we don't want to just be that person who sits in the corner and says yes and doesn't really know what's going on. You miss a joke here or there. So we kind of stop going to bigger groups. We stop stimulating our hearing nerve because we have hearing loss. So we really do want to address that. Yes, go ahead.
And I have worn hearing aids for 30 years. Mm-hmm. And number one is I went to Columbia to see an audiologist because at the time I bought my first hearing aids, that was as close as I could get. I tried to move that down here, but was told, no, we can't take you because your hearing aids are still under warranty. You have to be seen up in Columbia. That is no longer true. Is that right?
So every hearing aid manufacturer has a very specific software that it's paired with, and that is how your audiologist makes specific changes. So if your hearing changes or something happens, that's called programming. And so depending on the hearing aid manufacturer, some of them can be programmed by another audiologist if they have the means and the software. Not every clinic has the ability to read out the settings from every hearing aid. So I have had a lot of patients in your situation that have bought hearing aids either from us or elsewhere, and they come to us and I say, I don't have the software for that. So it's possible to transfer care. all the warranty and information is with your manufacturer. And so every hearing aid has a serial number depending on the clinic. Like I said, if they have the means and the software, they can open your hearing aids, but if they don't have that software, then they can't make any of those kind of programming changes.
So if you have a nationally known hearing aid, I think it's Pronac that I have, that it's, that I should be able to find it.
It's pretty likely. You just find a clinic near you and ask them if they have, if they fit that manufacturer, or if they have the software for that manufacturer.
Okay, so it's no longer that you're tied to that audiologist simply because your hearing aid is under warranty.
That's correct.
Okay, that's great.
Mhm.
And then another thing that I have found, I play the piano, and sometimes I practice without the hearing aids in. And I can tell you going up the piano without the hearing aids in, and I said to my audiologist this last time, at such and such beyond middle C, I can no longer hear adequately. And she looked at my audiogram and she said, oh yes, that's right.
Mhm.
So that you could just almost do your own hearing test.
So it's most of the time, and like I said, hearing can kind of be caused by any kind of disruption in the ear system. Most of the time, especially if your hearing is related to just kind of aging and noise exposure and things like that, yes, presbycusis is what it's called, that typically affects the higher pitches first. So a lot of people start to notice that they don't hear women and children as well as they used to, and so that is kind of the first sign that they kind of are noticing hearing loss. And I'll kind of talk about what high pitches do and what low pitches do here in a minute, but that's pretty likely that if that's what your hearing loss looks like, that any of those higher pitches above middle C is probably what's giving you trouble. And so just also remembering that hearing aids are not called hearing perfection, they're called hearing aids. That's what I always say. They're not gonna make you hear like you were when you were 20 years old. It is still a very electronic sound a lot of the times. It's not as natural as, like I said, when we were 20 and our ears were working just fine. Does that answer your question?
Yes.
Anybody else have a question? All right. So the other thing I really quickly like to touch on with this slide is kind of what I call alphabet soup. It's a PCP versus ENT versus AUD. So PCP stands for primary care physician, and ENT is an ear, nose, and throat doctor, and an AUD is what I am, an audiologist. So these are all doctors. They're very educated in their fields. Most primary care have a little bit of understanding about hearing, but not much, because they are experts in the whole body. And so if you go to your primary care and you say, I have hearing loss, it's very likely they're gonna refer you to a more specialized doctor, an ENT or an audiologist. A primary care physician, I think the statistic is about 33% of the time kind of knows, okay, you need a hearing aid or something like that, versus an ENT or an audiologist. They do that every single day. They have a little bit more understanding. An ENT typically will address the surgical side of things, or if there's an ear infection, he can prescribe ear drops, things like that, versus an audiologist like myself is the one typically to do the hearing test and to get you the hearing aids. So it's a little difficult, and everybody kind of says, why does it take, this process is so difficult? Depending on your insurance and your physician, you may or may not need a referral from your primary care. That's usually the first stop people have, but then they keep saying, why do I keep getting referred to another doctor and another doctor? I just want hearing aids. And so that's kind of the process. You can always just go straight to an audiologist if that's what you're looking for, but typically people will start at their primary care with some concerns for hearing.
I have
Yes?
a question. So then, it's still, if we feel that we need a new hearing aid or we want our hearing aid adjusted, you need to go through an audiologist.
Yes.
Okay, so buying a new hearing aid will still be through an audiologist?
Yes, that's correct.
Okay, I understand that because of changes in the law regarding hearing aid, there will probably be a lot more hearing aids coming on the market. number one, the price, fortunately, is going to go down because they're so expensive, many people can't afford them. Then you are still the one as the listener who decides when you want a new hearing aid. And so you go to the audiologist and they will still recommend what hearing aid you probably should buy?
Yes, that's correct.
Okay.
Mm-hmm. Did you have a question as well?
I was just gonna mention that ENTs are, they do the earwax removal.
Yes, they do. Yep. So your ENT is going to be the first stop for things like earwax, or again, if you are having balance issues, they are the ones who are going to put in the order for balance testing, things like that. So they're kind of, all these fields kind of overlap just a little bit. ENTs and audiologists work very closely together, but they do manage different things regarding the ear. Okay. Any other questions?
Did you tell me if the Capital Regional Medical Center has permanent audiologists, or are they people who are sent down from Columbia?
They're sent down from Columbia, so they're part-time here in Jefferson City. Yep. Okay, so some causes for hearing loss include just genetics. Some people's genes just make them a little bit more vulnerable to hearing loss. If your parents had hearing loss, especially at a younger age, that's kind of something to kind of look out for. We do universal newborn hearing screenings now. It was different in every state, but around the year 2000, the United States kind of implemented that. So we do test children when they are born, and every child leaving the hospital does have to have a newborn hearing screening to see what their hearing loss is. So maybe some of your grandchildren have had that in the hospital. It's just kind of one of those tests that they run in the first couple of days of life. And there are also regular school screenings to catch little kiddos as well. Another cause can be ear infections or wax buildup. So again, if that wax is in the way or that ear infection is preventing that eardrum from moving, you're likely going to have some hearing loss. My little tip with this is do not use Q-tips. If you're going to take anything away from this, that is my kind of like shoebox. It's more likely that you are going to push that earwax further and you might rupture an eardrum. So Q-tips are not the way to do it. Earwax, while gross, it's usually just kind of works its way out. Kind of take like a towel, like a damp towel, and just kind of rub the bowl of your ear instead. If you are concerned for a lot of earwax buildup, that is something that you would probably go to either your primary care or an ENT to get it professionally removed. Age is probably the most likely cause, again, that presbycusis. So 25% of adults age 65 to 74 and 50% of adults older than 75 have hearing loss. Again, it's just one of those things. Our cochlea is like any other, it's not a muscle, but like any other muscle, just over time it breaks down. And those hair cells that are responsible for the pitch in the cochlea do not regenerate. They are one part of our body that does not regenerate over time. Trauma to the ear, so a ruptured eardrum, either because of a car accident, you got hit in the head with a baseball, whatever, or any other kind of head trauma. Again, it can affect those bones or it can hurt that cochlea, causing some hearing loss. Any kind of abnormal growths or tumors, it's not always associated with pain or other symptoms like dizziness or tinnitus, but it can sometimes be, and so that's why your primary care likely looks in your ears to see if there's any kind of growths in there or anything like that. It can also be secondary to illness, so things like meningitis, rubella, or scarlet fever, other big kind of whole body infections like that can affect hearing as well. Yes?
Has there been any correlation with hearing loss from COVID?
A lot of not so much hearing loss. I have had people have some concerns with COVID and tinnitus, that ringing or buzzing in their ears. More so the effects of COVID is we started wearing masks. People couldn't read lips as much. They realized they had hearing loss where they were compensating before. but I have not seen any, and I think we're just kind of a little too close to it. There's not been a lot of research, but I have not seen any correlation with COVID specifically. I think this died. Oh, there we go. Okay, and then the other thing is a sudden hearing loss. This is considered a medical emergency, and you should see an ENT or audiologist immediately. So sometimes you just wake up and just hearing is gone and there's no explanation for it. If it does not come back in, like 24 hours, it's really important to see an ENT. We really want to figure that out. Sometimes hearing can come back from a sudden hearing loss, sometimes it cannot. So that's one of the medical mysteries out there, but it is considered a medical emergency. And then the last thing, again, one of the more common ones is noise exposure over time. So loud noises, guns, fireworks, farm equipment, all of those things can cause trauma, can burst an eardrum, again causing a hearing loss, or it can just kind of bend those hair cells so that they just don't come back. So just damage over time with loud sounds. Yes.
One thing that I've never seen on a list like this, and I've read a lot of things about hearing loss. My husband, having very short legs, sits very close to the steering wheel, right up against his stomach. Very minor accident, less than $5,000 damage, set off the airbag.
Mm-hmm.
And the explosion from the airbag just blew out his hearing. He had major hearing loss from that. And that people really, you should sit as far back from the steering wheel as you can. Just every inch farther away from that explosion helps.
Yep, so big things like an airbag, again, guns, things like that can,
Yeah.
yep. And so if the airbag at all kind of hit like his face, or I have had people just kind of fall over on a bicycle and they just kind of hit their head. Everything kind of in our head and neck is very close together. All of our nerves are close together. And so things like that, trauma like that does cause hearing loss. Yes?
Being the generation that we are, a lot of us in our younger days listen to a lot of rock music.
Yes.
And with the improvements in the stereos, and so forth, high-tech, stuff and everything there. The bass and everything there could just, and even the discos back in the day, the bass was just thumping. And I just wonder if some of the hearing loss of today is the result directly of that exposure.
Very likely. Very likely. I know the age of rock and roll was a fun time, but it's possible some of those effects might not have been, like it didn't feel like it in the time, and so a lot of research wasn't done yet, and so it felt like, it was okay, and then now people are kind of starting to feel those consequences years later, but that's a very common thing as well. The loud music, loud speakers, yep.
And the parents told you to turn it down, and it went in one ear and out the other.
Yep.
I'm sorry.
That's when it did the damage.
And I'm sorry,
Doesn't OSHA now require that there be some ear protection in?
Yes, so in a lot of factories and things, there are more regulations today than there were in the past. But just general concerts and stuff, there typically isn't regulations on those because those are considered entertainment. But I do recommend people wear hearing protection in any kind of just mowing your lawn, even though it feels like it's only 10-15 minutes. That 10-15 minutes over the next 20 years can cause damage. And then I actually did bring some hearing protection with me. It's always good to get them as far into your ears as possible. That's going to keep the sound out. And then you can also get custom hearing protection from an audiologist. Yes, is there a question over here?
Yes. I understand that those loud dryers in Walmart or whatever for drying your hair is a problem.
So they are pretty loud. Your best bet is going to be, it's not like we're wearing hearing protection when we're going to the restroom, public restroom or anything like that. If you can wear hearing protection, that's always going to be best with, like I said, like guns. You're about to shoot guns, you'll put some hearing protection in. Distance is going to dissipate some of that sound, so it kind of if you are going to a concert or something like that, you don't want to stand right next to the speaker. Standing farther away from it is going to help. And just general time. So instead of standing there for 20 minutes, like a 5-minute, well, drying your hands. I don't know who's spending 20 minutes doing that, but just so all of those kind of factors play a role. So time, distance, and how loud they are. So just kind of being cognizant, our world has gotten a lot louder, and so that's just kind of something to be aware of. And then, yes?
Our granddaughter is in cheer, and when we go to her competitions, the noise drives me insane. I wonder if you're beginning to see hearing loss in younger people, or if this is something that's going to be a later problem.
Yes and no. There's a lot of, like I said, when you're younger, a lot of the times you can compensate a lot better. You can use context clues so they just don't feel like they have as much hearing loss because they're able to still understand speech. Whereas when we get older, just like everything else slows down, so does our ability to compensate in a lot of those situations. Again, we have regular school screenings now, so we're kind of catching more of those cases with the younger generation. Yes?
There's a gun store in Columbia, I can't remember the name of it, it's on Brown Station Road. I think it's about once a month they have a lady that comes in who actually makes a mold of your ears. So it's not just custom fitted, it's actually custom made.
Yes, so they do offer that. An audiologist can also do that if that's something you're interested in. If you have a lot of hobbies that have a lot of loud noises and things like that, you can get custom made hearing protection, which is a lot more comfortable usually. Any other questions? Okay. Yes?
I noticed that young wrestlers are now have ear covers over. Is that to protect the ears being taken off or from loud sounds?
It's usually to protect from the germs on the mat getting into your ears, because our ears are very enclosed, small, usually moist place, which is a great breeding ground for bacteria. A lot of wrestlers get what's called cauliflower ear, and so it's not quite an ear infection, but it's a deformity of the ear because of that bacteria. So it's more for that, less for the loud sounds. But that is, so if you're not going to do those little foam earplugs, those ones that hearing protection that goes over the ear is also good as well. Yes?
I went to an Elton John concert last spring. And it was inside. Didn't even think about it. Oh my God, it hurt.
Yeah.
It rolled up clamps and stuck in my ears. It was so loud.
Yes, those get very, very loud. Okay, some audiology red flags. So these are things that I would say if you are experiencing these, it's probably important that you go see either an ENT or an audiologist right away. The first one is a difference between your ears. So if you are noticing a difference between your ears, it's likely something is going on. It could be a tumor. I have a lot of people who are right-handed shooters and they have more hearing loss in their right ear because that's where the gun is closer to. Again, if you have a sudden hearing loss, it's likely going to be in one ear before the other one. So especially if you're noticing a big difference between your ears that wasn't there before, definitely go and see your audiologist. Ear pain or pressure, that includes any kind of blood, drainage, or other foreign bodies coming from your ear. Dizziness is one of those things we'll talk about here in a minute. Again, that ear is important in sending signals to our brain about where our body is in space. And so a lot of the times with hearing loss, you get dizziness as well, and it's something like a tumor or something like that is going to cause multiple symptoms. Sudden or pulsatile tinnitus, so if you're starting to hear your heartbeat in one ear or both, again, not just because you're listening to your heartbeat, but if you hear a very loud clicking, buzzing, or something that's kind of like a beating to your heartbeat, go and see an audiologist, as well as sudden onset or rapidly progressing hearing loss. So kind of all those things, it's important to see your audiologist right away. Those are kind of the big red flags. Okay, I really quickly want to go through this slide. There's kind of a lot going on here. If you do get your hearing tested by an audiologist, you are going to get your hearing test in what's called an audiogram, and this is how we measure hearing loss. A lot of people come into my office and say, what percent of hearing loss do I have? Hearing loss is not measured in a percent, it is measured in what's called your audiogram. And so if we just kind of focus on the left side for a second, going this way on the graph, we have low pitch to high pitch. Again, like keys on a piano, just like that first slide we were kind of looking at. And then here at the top, we have very soft sounds going down to louder sounds here at the bottom. And so when you get your hearing tested, everybody knows when you hear the beep, raise your hands. And so what the audiologist is doing is they are playing a tone at every pitch, and they are marking how loud that tone has to be in order for you to say, yes, I heard it. And yes, we do check you a few times, so it's okay that you were breathing through one of them or whatever. And so here at this 25, what's measured in decibels is considered normal hearing. So you want your hearing up on the top of the graph as high as you can. So our right ear here is marked with red circles, and then our left ear is marked with blue X's. And so here on the graph, we have normal hearing in the right ear, and then we have kind of moderately severe to severe hearing in the left ear. So there is a number range in which we measure hearing loss, and it can vary between pitch. So most people, again, with that presbycusis, that age-related hearing loss, will have good to mild hearing in those low frequencies, which will kind of slope into the moderately severe to severe range. That means nothing to you, I'm sure. So we look over here. This right here is kind of hard to see, but it's kind of a banana shape. That is what is referred to as the speech banana. In the English language, a lot of speech energy is in the low frequencies, where a lot of speech clarity is in the high frequencies. So what that means is if you have good low frequency hearing and poor high frequency hearing, a word like fin or shin, you might catch that somebody has said something. You might say, oh, there was an N in there, I know what they said. Was it fin or shin? You might use context clues to figure it out. If I said, I hurt my fin, that doesn't make sense because I'm not a fish. So you might figure it out that way. But your brain is using a lot more information. It's really thinking harder to hear. And so, whoops, I did not mean to zoom in that far. All right. And so letters like F, S, T, H, P, they're very soft and they typically get cut off if we have a high frequency hearing loss. So it doesn't mean you're missing everything, it just means that you're missing a little bit of that clarity. And that's typically where something like hearing aids, which again we'll talk about a little bit later, can kind of give you a boost in those frequencies. And so a lot of hearing aids are prescribed to your hearing prescription, and they're gonna give you a boost in where you're missing things. We don't want them to boost everything overall because then everything just gets really loud. We do want to use any hearing, if you have any hearing, that's within that normal range. We just kind of want to give you a boost where you need it. And so that's kind of one of the biggest difference. Somebody had brought up some kind of the over-the-counter hearing aids and things like that. The more affordable hearing aids, a lot of the times they're going to just kind of amplify everything. They're not going to be specific to your prescription. And sometimes a little bit of a boost is all you need, and that's helpful, and that can help in a lot of situations. But something like a really complicated hearing loss is probably best fit by an audiologist.
Are you saying that many of the over-the-counter, which is the way a lot of people will be buying these hearing aids? Now, I understood that you would just automatically take those in somewhere and have the program. Are you saying some of them are not programmable?
Some of them are not. There's a big range, and they're still pretty new, so we don't know too much about them. Some of them are programmable, some of them are not, and it depends on whether or not each individual clinic decides to provide those services for the over-the-counter hearing aids. My biggest analogy is a lot of people in here are wearing glasses, so most of you guys probably have a specific prescription for your glasses. If you go to like a Walmart or a CVS and you get some of the readers from the counter, they're gonna help you a little bit. There's a little bit of lens in those, but they're not your specific prescription. So the over-the-counter hearing aids are kind of similar to that, in that they're typically made for a very mild to moderate amount of hearing loss. So if you have quite a bit of hearing loss, they are not going to help you as much. And again, their prescription is not going to be as detailed as programming with an audiologist. Okay. And so this graph over here also has some cute little pictures, and so that just kind of tells us that like a faucet running is pretty high on the graph, whereas like lawnmower is all the way down here. So if you have a flat hearing loss at 80 decibels, it takes about the same volume of a dog barking in order for you to hear all those pitches. So hearing loss, again, is not represented as a percent because it can be different at every single pitch. And so I kind of talked a little bit about how your brain has to use context clues to fill things in. This is what is referred to as listening effort. And so something that kind of gets a little bit harder when we have hearing loss and when we are getting older is that listening effort. So when things are harder to hear, it kind of reduces our ability to encode complex signals, including music and speech. It has an increased difficulty tracking fast-changing components of sound, again with speech, distorted representation of speech sound, so things might sound kind of muffled or just unclear, and you have a less accurate ability to read lips and process visual cues. So everybody reads lips to an extent, even if you don't know you're doing it consciously. That's why, again, a lot of people started noticing their hearing loss with the masks with COVID. And so oftentimes listening effort plays a role in how we're hearing. So it might not always be our hearing loss, but more just listening effort. So a lot of the times people are very tired at the end or the beginning of the day. They feel like they're not listening as well. I say I'm 90% audiologist, 10% marriage counselor, because a lot of people come into my office and they say, my husband must have hearing loss, he doesn't hear anything I say. And I say, he has normal hearing, he's just not listening to you. And so hearing and listening are different. Our ability to hear something is not the same as our ability to process what was being said. As our brain gets more tired, it has to redistribute resources into other places. So a lot of people, again, when they have poor health, their brain is kind of more focused on correcting the, any kind of heart issues, any, leg issues, whatever, and we're not putting as much effort into listening. So some communication strategies, some things that can help when we have poor listening effort or hearing loss. There's some things for the speaker, there's some things as well for the listener. So communication is always a two-way street. It does not matter if the other person has hearing loss or not. It is always going to be helpful for the speaker to slow their rate of speech. So again, a lot of patients come in and they say, my grandchild, I can't understand anything they're saying. And I say, typically younger people tend to talk a lot quicker. They tend to use a lot of slang we're not familiar with, and that just kind of mumbles and mushes everything together. So definitely slowing your rate of speech. Most people talk at about 200 words per minute. The brain can only actually hear 100 words per minute. So we're kind of catching every other word, but again, we're very smart, we can fill in those blanks. Getting someone's attention before you talk, so saying their name, is also going to be really helpful. If I just kind of say, hey, hand me that thing over there, instead of, you might kind of miss a lot of that, instead of if I say, hey, April, can you hand me that paper? They have heard their name, they're kind of more attentive to listening, they're more able to figure out, okay, I should be listening, what am I listening for, a command or something like that. And so again, a lot of people who come in kind of say, well, you put me in a sound booth and I knew I was gonna hear beeps. And I said, yes, you're waiting for the beeps. So same thing, if you hear your name, you're waiting for the next sentence. So it's always helpful to call somebody's name before you address them. Walk before you talk. This is a big, big marriage saver. So I have normal hearing. I cannot hear from a different room. A lot of people say that they used to be able to when they were 20. It's always important, if you're going to be the one to ask for something or say something, walk into the same room as that person, be in front of them. They're going to be looking at you, reading your lips. Again, this is helpful with or without hearing loss. So walk before you talk. And then a very easy one is repeat. Nobody likes to repeat themselves, but it's worse than saying, oh, never mind, because then the other person gets frustrated. So repeat exactly what you said. For the listener, using those visual cues or lip reading, eliminating or putting background noise behind you. Our ears are naturally shaped like this, so we're going to filter all the noise behind us and we're going to focus on what's in front of us. So turning to the person who's talking, turning off the sync when we're talking, things like that. ALDs, which stands for Assisted Listening Devices or closed captions. Those are helpful for everybody as well. A lot of places have new accessibility laws, so movie theaters and things like that will include closed captions if you ask for them. And just advocating for yourself in your hearing loss and repeating what you heard. Saying, did you say this or did you say that? And they can say yes or they can say no, and it's a good just clarifying what you heard. Amplification is also one of the areas of scope of practice. Hearing aids are the most common. Again, they're going to give us a boost in the places we need to, and I believe David's going to talk a lot more about hearing aids, so I'm not going to go too into that. But other things I want you guys to be aware of is there are more things out there than hearing aids. They're a lot more specific, but an osseointegrated, which is just a fancy word for bone-anchored hearing device. And so what those are is they address a very specific kind of hearing loss, as well as cochlear implants. You do have to qualify, and there is a lot of testing that goes into candidacy for a BAHA or a cochlear implant, and they are for very specific types and degrees of hearing loss, but there are other options and they're out there. Most commonly, a hearing aid first. Tinnitus, which is the ringing in our ears, can be associated with hearing loss, noise exposure. So a lot of those times, those loud Elton John concerts are you're going to leave and you're going to say, my ears are ringing and they're hurting. Stress is a big thing that can worsen tinnitus. Dental or cardiovascular issues, again, the jaw and everything in the head is pretty condensed. So if we're kind of clenching our jaw, I have had people have tinnitus from that. Acoustic neuroma, which is just a fancy word for an ear tumor, is going to be associated with tinnitus. Some side effects of medication can include tinnitus as well, and outer ear and middle ear issues. So all these things are included they're not direct causes of tinnitus, but they are associated with tinnitus or worsening tinnitus. Some ways that we can treat the tinnitus, a lot of the times amplification or hearing aids can kind of address our hearing loss and make the tinnitus not as bothersome. Other things like medical or medication management, so if we're on high doses of medication, kind of talking to our primary care about changing the dosage can sometimes help with that tinnitus. Diet restriction, caffeine, alcohol, salt, all the fun things can cause a little bit of tinnitus, so restricting those. A lot of sound therapies, there are apps on your phone or white noise machines that can help. So a lot of people tell me, I have a lot of tinnitus, it's okay when I'm wearing my hearing aid, but when I go to sleep, I take out my hearing aid and I can hear it really bad. Something like just a fan running or white noise is just there. It seems counterintuitive, but it is there to kind of distract you from that internal noise that you're hearing. Stress management and meditation. So again, stress is a big influencer. I have had people tell me, my tinnitus gets really bad before I know I have to do something with my kids, and I say, take a couple deep breaths. If we know we're gonna get a really bad bout of tinnitus, then we can kind of manage that kind of cycle, and that is what cognitive behavioral therapy does, is it kind of tells us, okay, we know we have tinnitus, try not to focus on the noise, focus on other things, deep breathing, meditation, things like that. And then the last recommendation is a tinnitus journal. So writing down every time your tinnitus is really bad, you start to see patterns. Again, typically right before we go to bed. Balance disorder, I'm really quickly going to touch on. It can be related to hearing loss, but it is not always related to hearing loss. On average, patients see 4 to 5 doctors before receiving a diagnosis related to their balance. So again, this is kind of one of those like juggling around in that alphabet soup. You typically go to your primary care first. They'll typically send you to an ENT, maybe do a little cardiovascular work, and then you finally get to an audiologist. So it's a little bit of bouncing around because the balance system is very complicated. This picture right here kind of shows us that vision, somatosensory or proprioception, and vestibular systems in the inner ear. So that is a very fancy way of saying that our body is constantly taking information from our eyes, what we're seeing in space, where our body is, what we feel, and the signal that our ear is sending to our brain. Our brain has to take all of that information all at once and say, if any of that information is contradicting or not what we expected it to be, we must be spinning, we must be moving. How can we correct that? So there can be kind of a breakdown in any of those areas. Again, as we get older, less feeling in our feet, less good vision, less good hearing. So we're gonna have a lot of trouble with our balance as well. So again, if our brain cannot process that information, our brain has to put resources into other places, so we're sick, things like that, we might not be able to keep our balance as well. Quick little pop quiz, and I do have a couple prizes. Can anybody name 3 of the communication strategies that we talked about today?
Speak slower.
Speak slower. Go ahead. Do you have other ones? All 3.
Make sure you can see your speaker.
Yep. Look, visual cues from our speaker.
Use their name.
And using their name. Yep. Okay. Can anybody name 2 treatments for tinnitus?
White noise.
White noise
Stress management.
and stress management. Good. And then what is the purpose of the cochlea, that little snail-shaped guy in our ear? I'm sorry?
To bypass the hearing nerve.
To,
The cochlear.
to encode pitch and send signals to the hearing nerve. Yes. Okay, so really quickly, just in summary, I really wanted to talk about annual hearing tests. They are recommended, especially if you have a known condition or a known hearing loss. We do want to monitor that progression. History of noise exposure or just other ear issues in general. Medicare will cover 1 hearing test per year. That is not calendar year, that's year from your last hearing test. Medicare will cover 1. Our ears are responsible for hearing and balance, so it's important to take care of them, wearing hearing protection when necessary. On average, it takes people about 7 years from the time they are diagnosed with hearing loss to the time they finally pursue hearing aids. So a lot of people start to notice a little bit of trouble. They get their hearing aid, or they get their hearing tested. They say, oh, I can wait a year or 2, and then things get pretty bad before they decide to pursue hearing aids, whether that's a financial concern or they're just not mentally ready for it. It takes about 7 years. And then our world has really become a noisier place in recent years. Even people with normal hearing like myself can benefit from those communication strategies we talked about. There have been studies that a lot of movies have kind of brought up the action scenes, the car explosions, the music, and then lowered the speech. So I have trouble with those. A lot of restaurants have very poor acoustics so that you don't sit and hang out, so that they can kind of cycle through patrons a lot faster. A lot of places that were made a long time ago don't have, again, a lot of accessibility or good acoustics because that was just not something that they were thinking about during those times. So our world has become louder and noisier. And so that is the end of my presentation. I have put the number and address for our Capital Region location as well as our location in Columbia. I do have just a few business cards and a couple pamphlets and some hearing protection if you guys would like to grab any of that during the break. Yes,
You're talking about that 7-year delay before they do, that's not always on the patient.
that's true.
I have been tested, and every time, you can just put on tape recorder, yes, you have hearing loss, but it's not bad enough for a hearing aid. I mean, I've heard that so many times, and if we gave you a hearing aid, it would wind up in your drawer, it would multiply other sounds too loud.
That's true, that's true. So there are a lot of gray areas in balance as well as hearing where and you can have, like I said, depending on the pitches that you're missing, it can be not as urgent to get hearing aids. And so you're right, it's not always on the patient. Yes.
So if you thought that you would like to be tested, how would you start out? Who would you contact? In the protocol of it, you don't have to go through a primary care physician, I don't guess, do you?
You do not. I would double check with your insurance, but I don't believe Medicare requires a referral from a primary care physician. You could just call any office with an ENT or an audiologist and they can send you to the right place to get your hearing tested, just so you have a good baseline.
But I made the mistake of not going through my insurance company first, and they wouldn't pay anything.
Yes, so it's really important to check. Yep, every insurance is really different when it comes to hearing loss, especially. It's not one of those things that's covered in like your annual physical, so it's different codes. Yes.
Do you come down here to Jeff City?
I do not. I'm full-time up in Columbia, but our clinic does have 3 audiologists that cycle through Jeff City that they do hearing tests and hearing aids as well. Yes.
Explain pitch as opposed to volume or loudness. What is the difference when you say pitch?
So pitch is going to be, again, low tones versus high tones. So again, like he's on a piano. So one end of the piano is very low and bassy, while the other is very high pitched, kind of almost squealy. So that's what the pitch is. Yes. Mm-hmm.
Man at the table.
Yes.
I know the audiologists can check, do their thing, but is there actually a physical picture they can take of your ear?
There is not a physical picture. When I look in your ear, I am only seeing up to the eardrum, and I'm typically just checking for wax or any of those growths or anything. If we wanted a picture of your cochlea specifically, that would be imaging like an MRI or a CT scan. Typically, we only do that if there's one of those red flags, so like a difference between your ears or something. And even if I do take a picture of your cochlea, it doesn't necessarily tell me how much damage there is. That is something that's done through the hearing test.
It's not your jaw and things of that nature, can they check anything there?
Not typically. Mm-hmm. Yes.
I have a problem with wax buildup,
Mm-hmm.
and I've had my ears washed out at the primary care physician's office. Is there any need for me to worry about their ability to not damage my ears?
No, if you're going to get them professionally cleaned like that, there's not typically any issues with that. I would be wary of some of those kind of at-home cleaning. They say they do the same things, but that's a little, I would stick to the professional.
Thank you.
Yes.
Another audiologist was adamant that when you wake up in the morning, your hearing aids should go into your ears. And what I do is stick the earbuds in my ears, and I'm listening to a radio, and I hear that very well. And then I'm alone during the day. I don't have anyone talking to me. So sometimes I don't actually put the hearing aids in until I'm going to watch something on television, which may be 11 o'clock. I don't know if that is a stupid thing to do, because no one is going to be talking to me. I don't have the radio, the ambient radio
Right.
running.
Mm-hmm. So likely what they were recommending is that just like we don't want to buy hearing aids and have them sit in a drawer, it's really important, just like any other muscle in our body, to kind of work out the connection between the ear and the brain. And so even though there's nobody, at home because we live alone or there's no radio going, just having your hearing aids in and the small things that you may not even notice, your refrigerator kicking on, your HVAC kicking on, things like that, those very small sounds. There have been studies that show the more you wear them, which is kind of why we recommend wearing them all waking hours, the better you will do. And so if we can hear very well in a quiet situation, that is going to make when we hear in a very noisy situation a little bit easier, because we're more used to that amplified signal.
I thought I saw a question over here.
The audiologists at Sam's Club and places like that, are they just as good as anybody else?
There are good audiologists and there are bad audiologists. There are also what's called a hearing instrument specialist, and I believe is that, yes, and that is what David is. And again, there are good hearing instrument specialists and bad hearing instrument specialists. It just kind of depends on what you're looking for. I would definitely say if they can answer your questions, they're likely good. It's hard to know who to trust. I would, just like any other kind of doctor, it's your prerogative to get a second opinion if you feel like they're not giving you the answers or they're not programming your hearing aids accordingly or anything like that. It's always good to get a second opinion. I can't say that for every Sam's Club. It just kind of depends. Yeah.
If I'm going to buy a new refrigerator, I go look at Consumers Report.
Mm-hmm.
Where would I find, or will I find, an evaluation or a comparison of hearing aids, especially if it's anticipated, since more people will be buying them, more will be out there?
Some hearing aid manufacturers are in Consumer Report. A lot of research. Again, it's important to one thing that I do when I have patients who kind of want to shop around is I tell them the manufacturers that I'm comfortable with and that I fit. Typically, just like Apple comes out with a new phone every couple years, every manufacturer will come out with a brand new device every few years. And so there's always kind of something new and shiny on the market. So it's more important to find somebody who can fit them appropriately than to find the newest, best thing. Yeah, I would say if you want some kind of reviews, Consumer Reports, or the manufacturer websites or manufacturer brochures.
Thank you very much.
You're very welcome.
We're going to take a 10-minute break, or just a little less than 10 minutes, about 8 minutes. And I hope you all had a chance to speak with Dr. Nguyen. And now we have David Bollinger. And he is here in Jefferson City. David was born and raised in St. Joe, Missouri. He graduated from William Jewell College in Liberty, which is just north of Kansas City. After getting married in 1978, he and his wife Mary lived in Kentucky, and they lived in Iowa, and in Oregon, and in California. They couldn't keep you anywhere, could they? So finally brought you back here to Missouri. David and Mary have 2 adult sons. One lives in Springfield and one in Nashville. They have no grandchildren, but hope springs eternal. David and Mary work for ClearSound Hearing from locations here in Jefferson City and in Fulton and in Columbia, and have been in the hearing healthcare field for over 20 years. Please welcome David Bollinger.
I would add 3 more initials to the list of initials. One is HIS, Hearing Instrument Specialist. That means that we are licensed by the state to dispense hearing aids. That's what I am. And as a hearing instrument specialist, that means that a lot of the things that were discussed earlier are not within our scope of practice. We primarily work with hearing instruments, hearing testing, and then proceed from there. If we see some of those red flag issues that were discussed earlier, one of the very first things that we do is refer you out to an audiologist or an ENT, and have had good relationships with some of those local ENTs and audiologists, both in Jefferson City and Columbia. I am going to digress for just a moment. My wife and I were married 17 years before we had the first kid. So we're only recently marrying off our children. And so our oldest son lives in Nashville. He's a guitar player. And so he was not interested in pursuing a relationship because he was a musician. And then COVID came. And he discovered, found a girl, and they decided to get married. And so as they began that process, they decided they'd have a fairly large wedding, about 200 people, have a dinner, the whole thing, and then they found out how much that would cost. And then laid alongside that, how much a house in Nashville, Tennessee costs. Entry-level house, about $300,000, so they decided to have a much smaller wedding. So they were going to just have some friends and family come over, but they would still have a dress. And then they found out how much a dress would cost. And then they decided that instead of doing all that, they would go to the courthouse and get married, and then we family folks would come in and we'd have dinner together. So, and I don't care at all. So they went to the courthouse, we started driving to Nashville, and so they get to the courthouse and get a marriage certificate. And they find out that it was going to be about an hour or two before the Justice of the Peace can do whatever the Justice of the Peace does to make it official. And my son is a little bit like my wife. He goes to the counter and he says, "Isn't there any way we can do this a little bit faster?" And so they said, well, in the state of Tennessee, to get married, all you've got to do is sign your name to the marriage certificate and get it notarized. Okay. So they pull their phones out, they do all their work on their phone, and so this is the wedding picture of my son being married at the UPS store at Belmont University. Which takes me to the great philosopher Bob Dylan wrote, "The times they are a-changin'." And that is certainly the case in the hearing aid field as well. We are going to just review just a little bit the mechanism of the ear. Sound certainly comes in from the pinna into the ear canal, causes vibration in the eardrum, so that motion is transferred into vibration. That energy is passed on to the three little bones in the middle ear, and then through the oval window into the cochlea. And again, the cochlea's job is to take sound and to break it apart into all the component frequencies. The beginning of the cochlea detects those high-pitched sounds, and as you go further in, it detects lower-pitched sounds. So, because all of that sound is passing through the oval window and into the first part of the cochlea, it beats up those first hair cells, and we tend to lose our high frequencies first. And then some of that energy is dissipated. So as you go in, it detects lower and lower and lower pitches, and that we still hear. So oftentimes I'll have folks come in and say, particularly men, they'll say, I hear fine. I can hear a train coming from 2 miles away. And they can, but they have difficulty understanding individual speech sounds. High frequencies, K, T, F, S, TH, P, H, G, SH, and CH, which are in about 40% of the words in the English language. So we struggle not so much with hearing, but with clarity. And oftentimes that's one of the things that we talk about a lot. We don't oftentimes need the world to be louder. We need speech to be clearer. And that's what modern technology can do. Older style technology, not so much. Some of the very first hearing aids were just a result of someone going like this, trying to take that sound and send it more efficiently into the ear. And so for that reason, this was kind of before the time of electricity. So we had the ear trumpet. And I've seen the frequency response of an ear trumpet. It actually does amplify some of the sounds. But primarily it takes that sound and focuses it into the ear. That was fancy, I'll tell you. And then we had listening tubes, which again takes that sound through the tube into the listener's ear.
It looks evil.
It really does. We also had what was called auricles. These were sold oftentimes to women because with longer hair, you would have a headband that goes over the head, and they would extend the the ear canal to be able to capture just a little bit more sound. Some of us don't have that hair to cover it up, so it would be still fairly obvious. 1820, the King of Portugal had a unique throne constructed. And so there are openings in the arms that would take that sound, and then he would put that into his ear. So folks coming up to talk to the King of Portugal would basically yell into the arm. Isn't that fascinating? But it's also ingenious. That's fairly discreet. And then to take it one step further, uh-oh, lost one. Okay. There's a photo of these huge bells, probably 12 feet long, that were used for civil defense purposes. So a man or a soldier would have headphones on, and these huge bells would take the sound of incoming aircraft and send it to the ear. But before electricity. About this time, 1878, the first patent was obtained by Alexander Graham Bell 2 years earlier than this for the development of the telephone. And so the use of the carbon mic was one of the threshold events in the development of hearing aids. And what is a microphone anyway? What is a microphone anyway? It's an attempt to take sound and to convert it into electrical energy. And oftentimes, now this has a battery in it, but they didn't have a battery in that one. And it would take, you'd have a big coil, and that sound would create a very, very small electrical impulse. And then through one of the first carbon mics. And then you would have, think about what a telephone is. It's taking sound and sending it over a long distance, but it's not necessarily amplifying that sound. So some of the first hearing aids would take the sound from the carbon mic and allow it to be sent to the ear a little bit more directly. Not a lot of amplification. So not until the development, and they took many forms, not until the development of the vacuum tube were we able to provide amplification. Any electrical engineers here? Good. That way my explanation will make sense. A vacuum tube is taking very soft, small amounts of electrical impulse and allowing that to control a more strong current of electrons. Boy, that wasn't very good. I liken it to a hose. You're going to water the backyard, and you've got this little valve that opens and closes the source of the water. So you've got this force of water that's controlled by this little valve. In England, vacuum tubes are called valves for a very good reason. So this small amount of input can manipulate this stronger force of electrons. It was the vacuum tube that allowed us to begin amplifying sound. As much as 70 decibels of amplification as a result of the vacuum tube. But they were fairly large. They required a lot of electricity to create that flow of electrons. So oftentimes they were tabletop units and had to be plugged into the wall whenever that became available, or huge batteries. So you'd have to carry them around, or they were tabletop units. Then we had the development of the transistor that allowed this very weak electrical signal to affect that more strong force of, flow of electrons. Then we were able to do that with DC current instead of AC current. And they were smaller, so much smaller. Which then allowed greater miniaturization of hearing aids. So in the 1950s, as a result of transistors, we were able to put the mechanics of the hearing aid into the earpiece of eyeglasses, and then you would have ear molds that would go down into the ear. Do you remember some folks that had eyeglass hearing aids? They're really not readily available anymore, but again, an ingenious solution to a problem. With the advent of transistors, oftentimes there were hybrid units that used both vacuum tubes and transistors for the amplification of sound. This being an example. Zenith put out one. And I remember folks at church having what we thought were cigarette packs in the front pocket, but were actually hearing devices.
Okay, and did they have a rating range of sound, or did they just increase all sound?
Primarily, they increased all sounds. It was only later that they could adjust frequency response a little bit. And then then there was a side business in doing the holders or the battery packs. So I think this was the Sears catalog, and you could get the amplifier holder for $2.25. That wasn't small money at that time, as well as the battery case. It was not until 1955 that a company Sonotone came out with a 100% transistor behind the ear hearing aid. And this was landmark. And as I get older, 1955 is not all that long ago. 100% transistor. But not until 1995, when Whitex came out with the Senso product, did we have a 100% digital hearing aid. So what on earth does he mean by digital? Oh boy.
White noise.
Okay. So we're going to make this up as we go. So with digitalization, we take analog signals. The sound of my voice has smooth, melodious waveforms. Melodious was my word. Nice, smooth waveforms. With digitalization, it goes into a digital converter, and everything is changed into digital signals, zeros and ones. It becomes math. Any accountants in the room? Again, good. Because with math, we can do anything. When we can take a sound and reduce it to zeros and ones, the number of things that we can do to manipulate that sound becomes unlimited, limited only by the capability of the technology. And that technology continues to get more and more complex. So here's an example, and there's I've got one of the processing chips from one of Starkey's hearing aids, and it's tiny. It's an integrated circuit, and it's actually 7 layers thick. So Tom's going to pass that around so you can take a look at it. And be aware that this is older technology. This is probably 5, 6, 7 years old. And some of those first processing chips, it was amazing. They had 10 million transistors on them. And then Phonak came out with an integrated circuit processor that had 44 million transistors on it. This particular example has 109 million transistors on it. So that means that we can take these zeros and ones and manipulate them to do amazing things. How can they do that? This is a photograph of a human hair, and superimposed over it is one of the connectors in an integrated circuit. So, and they get smaller and smaller all the time. Starkey just came out with a product that was introduced yesterday that has 6 times more transistors than their previous product. It's just incredible. So it truly was a new world whenever digitalization took place. So what were we able to do? Here's a list of several things. We have frequency adjustability, and we'll define that in just a moment. We have input compression, noise management, frequency compression, feedback management, and wireless connectivity. So here's a fairly typical hearing test that I see on a regular basis. Again, we test from essentially middle C on the piano and go up 5 octaves. So each one of those big divisions is a do, re, mi, fa, sol, la, ti, do, up, 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 up. Speech lies from about 5,000 hertz up to about 5,000 hertz. So with this particular person, they hear the low frequencies just fine. They hear the high frequencies hardly at all. So they lose that clarity, the KFST, PHG, SH, and CH. I don't know the number of times that I have heard the story of a couple coming in and they say, not on.
Batteries just went out. They were replace batteries very quickly.
See, batteries are very important.
A lot of hearing aid batteries bristle when they go out, don't they? When they're fading.
They just make a noise.
Well, oftentimes they give you an audible signal. The circuit will, some say battery, so there's not a lot of ambiguity in that. Some will give you a beep, beep sound. Am I back? Oh, baby. Okay. So, the number of times I've heard the story of the wife coming home and saying, "Oh, I got a new hat," and the husband says, "Why would you get a cat? You know I don't like cats, and you didn't even talk to me about it." And he's upset about this new pet, and she actually just got a hat. And those are the kind of misunderstandings that can occur regularly when we miss one speech sound. And then by the time we figure out what was being said, the conversation has deteriorated even more. So, what do we need to do in this case? We need to amplify high frequencies without necessarily amplifying low frequencies. The older hearing devices made everything louder. So with this person, those low frequencies would just blow the top of your head off just to be able to get that clarity. Well, that's not going to work particularly well. So with digitalization, we're able to give you very specific frequencies. In this case, 3, 5, 6, 9 decibels of amplification in those low frequencies, with up to 24 decibels in the higher frequencies. So we're able to customize or provide a prescriptive response to that particular hearing loss. Yes?
This always goes through a computer, that the audiogram is run into a computer, and that's what sets up the hearing aid?
Now it is, yes. It used to be much more manual, but now it's much more easily automated.
And this is something that you do?
Yes.
Okay, so it doesn't have to be through an audiologist, that this is, now, you also do hearing tests?
Yes.
Okay, I'm just.
Audiologists are great.
Oh, yeah.
We think so.
And
Say that 'cause I'm here.
they really are. And she does tons of stuff that I wouldn't even think about even talking about. But a good hearing instrument specialist, and there are some, a good audiologist, and there are some, can make hearing aids do backflips for you. There are two things, however, I guarantee about hearing aids. One is they will never be as good as you want them to be. And two, if we work together, husband, wife, myself, if we work together, we can make them as good as they can be.
Well, you know, one of the things that I'm always getting ads, and I don't know why, but it's all bell tone. You know, it's like the only instrument in Jefferson City is bell tone, and I know that that's not true.
No, no. We'll talk about bell tone. They're actually made by a company called Resound. It's a Danish company, been around for decades. Excellent company. We'll also talk briefly about how a relationship with your hearing instrument specialist or audiologist is critical. The ability of that professional to hear what you say and respond with both compassion and technical expertise to address your issue. There are some that are great, there are some that are just trying to sell hearing aids. Okay. So, frequency response, we deal with that. Let's go back. So if I am not going to amplify low frequencies, but I am going to amplify high frequencies, then we're going to talk about something called dynamic range. Because in general terms, anything louder than about 100 decibels is really loud. And with normal hearing, anything better than 20 decibels is very soft. So this high frequency loss at 80 decibels, remembering that 100 decibels is really loud, we have a very small dynamic range. We've got 20 decibels to work with before it becomes uncomfortable. So how on earth do we do that? And that's why we have what's called compression. So with some signals, we have linear amplification. So if you've got 30 decibels going in, you've got 30 decibels coming out. But with some of those high frequencies, we've got that 30 decibel of increase would become uncomfortable. So we have compression that allows us to give you soft input louder, moderate input more comfortable, and loud input tolerable. That's kind of confusing, but it treats soft, moderate, and loud input differently. So those very soft sounds are going to be amplified more aggressively because we may not hear as well as we would really like. Moderate sounds, again, comfortably, and very loud sounds, much less so. All a result of digitalization. We can also tell the difference between steady state background noise and modulated speech sounds. And because we've got literally hundreds of millions of transistors and algorithms and all the fancy stuff that computers do now, a hearing aid is a little computer with more computing power than the computer that first put men on the moon. So they are able to identify background noise and speech sounds and reduce that background noise somewhat, but still give you the modulated speech sounds. Remembering my two guarantees, never as good as you want it to be, but but a far cry better than it has been. Okay, we're going to take a look at that audiogram once again. As a rule of thumb, a hearing loss greater than 70 decibels may have what are called cochlear dead regions, meaning the cochlea is so messed up that the sound that it hears is garbled, is not clear. So just making those sounds louder at frequency is just going to make things worse. So what can we do then? We can do frequency compression. So as a piano player, you've got high frequencies. What happens if you take a C 5 octaves above middle C and move it down an octave? It's still a C. And it still has some of those same musical characteristics as if it were all the way up at frequency. So we have the ability now, through digitalization, to take those high frequencies that we really are not productively hearing and compress them down into areas, frequency areas that we can hear. So a KT-FST, a t, t, t sound may sound like a t, t. It's still a T, and it still means the same thing, but we hear it in an area that we can hear better or more easily. Most all of the major manufacturers have this frequency compression or transpositional elements to the ability to be programmed.
And you decide that, is that right?
We decide that.
So it's the listener and you.
It is easy on our side of the desk to know what you need. But you need what you find to be comfortable and beneficial. And so we make those kind of decisions together. We may listen to music. We may just carry on a conversation and determine what is best for your situation at that time. We can always turn it on, we can always turn it off based on what your preferences and the effectiveness of that tool will be. Does that make sense? Okay. Feedback. Oh, baby. How many times did we sit in church and hear Grandpa's hearing aids go for hours on end? And how often do we put hearing aids in and go like this, and they squeal, and that's how we know that they're on? Well, that's not necessarily a good thing. Feedback is just simply the sound from the speaker trying to sneak back around and go through the amplifier again. You have the creation of a feedback loop, and it sounds like squealing. No, it is squealing. So what can we do about it? Through digitalization, sound comes into the, let's call it a preamp, comes into the preamp and it is digitally marked. So if it tries to sneak back around and come through again, the preamp says, oh, you've already been here, you can't go through again. And that reduces the feedback somewhat. What else can we do? We have dynamic feedback cancellation. So we can run some tests that tell us at what frequency feedback is more likely to occur. And we'll restrict some of those, that amplification at that particular frequency. As well as active gain adjustment. So digitalization allows us not to eliminate feedback, but make it much less pervasive in our hearing aid use. And this is a big thing now. Bluetooth connectivity. So we can now take a cell phone and stream music or the incoming phone call directly to the hearing aids. There are some manufacturers, you like that. There are some manufacturers, if you get an incoming phone call, you hear a little doot-doot-doot-doot in the hearing aids. Nobody else is hearing that. You can press the top of the button and accept the phone call. You can press and hold the button and send it to voicemail. You could be listening to a John Mayer concert right now and get an incoming phone call. It's going to pause the concert, allow you to talk on the phone, hang up on the phone, and go back exactly where you were in the concert. What else can it do? It can have alternate sending devices on your telephone or your television at home. So you can actually mute the television and still hear the sound in the hearing aids. Imagine how nice that would be during football or baseball season. For
Nice for your wife.
Yes, yes. Or you can set the television at a comfortable volume for one spouse, but be able to hear it a little bit louder in the hearing aids for your own use. What else can they do? They talk to one another. So whenever you hit the button on one side to increase the volume, it's changing both. Increasingly, they have accelerometers in them. What does that mean? Motion detectors. So using artificial intelligence, another byproduct of digitalization, they can tell that you are walking down the sidewalk and you keep looking over to the side. So they know that you're talking to the person on your right. You've got road noise on the left, so we need to reduce that. We need to focus a little bit more actively to the right. And you don't have to do anything for this to happen. We've got some hearing aids through digitalization that can literally tell that you are driving your car. Did I just turn that? Nope. They can tell that you're driving the car. They'll reduce the road noise side, take the speech from this side, and send it over to that side as well. And you don't have to hold your tongue just right. You don't have to say the magic words. It just does it. I liken it to getting grits in the South. It just comes.
David?
Yes?
Remote mic on your telephone so you can sit in front of somebody else?
You actually, with Apple technology, an Apple phone, you've got generally 2 microphones on each hearing aid. You've got one pointed forward, you've got one pointed backward. You can make your telephone a 5th microphone that you can put wherever you choose it to be. So if you've got a soft-spoken wife or husband, you can put that phone right in front of them or in front of the television and stream that sound directly to the hearing aids. The times, they are changing. And then we've got apps. We've got apps for everything, don't we? So using your phone, you now have the ability to change volume, change frequency response, change adaptive features, and by that I mean active noise reduction. You can go more directional. You can even adjust some of the compression settings to make soft speech louder or loud sound softer using your app.
You know, what if you want a workhorse hearing aid? I mean, one that work and without all, I mean, this is just getting beyond, it's kind of like your latest iPhone. It does a lot more than what I will ever ask it to do.
And I think that's one of the cool things with working with a hearing instrument specialist or audiologist. We can make it as simple as you want to be. A hearing instrument evaluates the environment now at least 700 times a second and makes changes based on what it hears. And we can set that in a way that is comfortable for you, so you don't have to turn it up, you don't have to turn it down, you don't have to do anything but wear it. But a lot of us are geeky, and us geeky folks like to be able to mess with things. We want to change frequency response. We want to do that. We want to stream music. A lot of folks don't. We just don't enable those things for you, so that you get the top level of technology at your comfort level. So
You're still paying for probably the very latest technology that's out there. You know, I still have to buy the iPhone 16.
no, you don't.
I mean, I'm using that as a comparison. I mean,
Well,
if I want new hearing aids, it's going to come with all this technology.
Probably so. There are different levels of technology, excuse me, within each family of hearing aid. You can buy an entry-level hearing aid that is still going to evaluate the environment 500 times or 700 times a second and make changes. But it's not going to do some of the other fancy things that you really don't care about, and it could be a fraction of the cost of the top level.
Okay, and what is the life of one of those hearing aids? You know, like the iPhone, I have an iPhone 6 and an iPhone 13. I actually prefer the iPhone 6. It's smaller and easier to handle, but I know the i13 does a lot more, and of course was a lot more expensive than the iPhone 6. So what is the life that I'm going to get? The iPhone 6, they no longer will deal with it, the company.
On the average, hearing aids last between 5 and 7 years.
5 and 7. Okay.
I have folks that get hearing aids every 2 years just because they can.
Okay.
So, and then there are some all-make repair labs that can take very old hearing aids. Not all that long ago, we sent in some of those eyeglass hearing aids that were able to be repaired, although they haven't been used for 70 years. So there are labs out there that can work on those. And then just an example of some of the things that you can do with the app. This is Phonak. You can change frequency response, volume, reduction of background noise, as well as compression. There are 5 major, some people would say 6, but I say 5 5 primary hearing aid manufacturers in the world. We'll just go, and this is kind of a flow chart of a whole lot of different companies, but most of it falls within those 5 major manufacturers.
Do we have that in?
You do, but you can barely read it.
Oh,
There are different styles of hearing aids, from these tiny little in-the-ear ones, and we're going to pass, 10 minutes, we're going to pass some examples around. Tiny little in-the-ear ones, slightly larger in the ear, or much larger in-the-ear ones, kind of in between, full shell. Probably the most common now are the behind-the-ear ones. They're just physically more comfortable, and in a lot of situations can provide the amplification that folks need. There are rechargeable in this size and this size, as well as this style. To the best of my knowledge, tiny little in-the-ear IICs or CICs. There are no rechargeable products available yet, because that lithium-ion battery, we didn't even talk about batteries, but those lithium-ion batteries are large enough that they can't go in those really small cases.
So you mean those are the ones where you can change the battery?
Yes, yes.
It's not one battery that lasts 5 years.
No, no. Well, originally they said no. Rechargeable batteries, they originally said that lithium-ion batteries would last for about 5 years. Pretty much I believe everything that people tell me now. So we're finding that they last 1.5 to 2.5 years and then have to be replaced. Generally, hearing aids come with a 3-year warranty, so that's covered within that warranty period. Resound, a Danish company, been around for decades, excellent company. They also make bell-tone hearing aids. Phonak, a Swiss company, owned by a company called Sonova. Their sister company is called Unitron, been around for decades. Excellent company, good hearing aids. I'm not going to say anything bad about any of these. One of the things that Phonak kind of pioneered was the development of a bicross system. And what that does, if you can't hear out of one ear, it takes that sound from that side and sends it over to the other side. Now, we know that the right ear primarily talks to the left side of the brain, left ear talks to the right side of the brain. So when we're hearing in both ears, things just work better. But if that's not an option, a bicross takes this input from over here and sends it over to the good ear.
Does it have to be bone conduction, or can it go in the ear, or?
It can go just standard hearing aid. Signia also was originally Siemens, and again, been around for decades. They also make Miracle Ear, okay? I don't have time to talk about all the geeky stuff that Signia is doing. Oticon, excellent company, also Danish. They use a slightly different approach. Instead of focusing forward or toward a speaker, they leave them more, your hearing more wide open, so you hear better all around you rather than specifically what you're looking at. There are both good and not so good elements to that. Quick story, his wife had hearing loss, the original developer of Oticon, and so the Crown Princess of Denmark was being married off to the King of England. So for her coronation in 1902 or 1903, she had hearing loss. So he found out about it, wanted to find out how he could help his wife hear better. He went to England, found out about the development of the hearing aid for the new Queen of England, and that was the origination of Oticon. It's just kind of cool. Starkey Hearing Technologies, of all of those companies, the only US-based company out of Minneapolis, owned by one guy, Bill Austin, who he's a piece of work, I'll tell you. He born in Nixa, Missouri, and went up to University of Minnesota to study medicine. Dropped out of medical school because he started making ear molds for hearing aids. He figured he could help more people on a daily basis if he made hearing aids rather than if he was a doctor. And now he has helped, as all of these companies have helped millions and millions of people. Baha's, we talked about that a little bit. So I'm just going through this really fast. Cochlear implants, fascinating. This fellow, 1790, did some of the first research regarding the electrical impulses of the ear. He stuck electrodes in his ears and passed 50 volts of power into those electrodes, and figured out that he could hear something. So that was kind of the discovery that the whole hearing system is based on electricity. I would love to talk about over-the-counter hearing aids. We are almost out of time. In 2017, a law was signed into effect by Donald Trump, which resulted in October of last year the availability of over-the-counter hearing aids. It also, not that over-the-counter hearing aids have never been available. They've been around for years. They just came under the purview of the Food and Drug Administration as a result of that law. They created two categories of hearing instruments. One, prescription hearing aids, although nobody really needs a prescription to get a hearing aid, and over-the-counter, making it available through retail outlets and over the internet. There are four major differences, considerations between over-the-counter and professionally prescribed hearing aids. We could talk about that a little bit later. Be aware that oftentimes your insurance, particularly Medicare Advantage programs, have hearing aid benefits. I'm seeing a ton of policies coming in that allow you to get hearing aids with professional services for as low as $425 per hearing aid. Sometimes, if you're retired state insured, you can get $5,000 hearing aid benefits every 2 years. So these low prices of over-the-counter hearing aids without professional services may not be as good of a deal as you think they are. So, I have talked too much. I would be more than happy to answer any questions, but I have been told that you guys like to get out of here at noon. So I thank you for the opportunity to be able to spend some time with you this morning.
Are there any questions before we go?